Welcome to Medconnect, where we'll provide you with a comprehensive overview of labiaplasty and plastic surgery. We aim to deliver this information in a way that's engaging and informative. Don't forget to like, comment, and subscribe at the end if you found this video helpful. Labiaplasty is a surgical procedure usually done to reduce the size of your labia minora, skin folds that surround your urethra and vagina. Excess skin can get twisted and pinched, causing discomfort during exercise, physical activities, and intercourse. You may also have labiaplasty for cosmetic reasons or as part of gender-affirming surgery. Who needs labiaplasty? Labiaplasty is typically performed for the following reasons. Physical discomfort. Some women may experience pain or discomfort during physical activities or sexual intercourse due to enlarged labia. Psychological distress. Feelings of self-consciousness or embarrassment related to the appearance of the labia can affect a person's self-esteem and body image. Why is labiaplasty required? Labiaplasty is required for individuals who have legitimate medical or psychological reasons to alter the appearance and functionality of their labia. However, it's crucial to emphasize that it is an elective procedure, and the decision to undergo it should be carefully considered. How is labiaplasty performed? The procedure is typically performed under local or general anesthesia and can involve one of the following techniques. Trim method. Excess tissue is removed along the edge of the labia, and the incisions are then closed with sutures. Wedge method. A V-shaped wedge of tissue is excised, allowing for a more natural-looking result. Combination method. This method combines aspects of both the trim and wedge techniques for tailored results. Procedure of performing labiaplasty. Consultation. Before the surgery, you will have a consultation with a board-certified plastic surgeon. During this consultation, you will discuss your goals, expectations, and any concerns. The surgeon will evaluate your anatomy and overall health to determine if you are a suitable candidate for the procedure. Anesthesia. Labiaplasty can be performed under local anesthesia with sedation or general anesthesia, depending on the surgeon's recommendation and your preference. Your surgeon will discuss the anesthesia option with you during the consultation. Marking and planning. Once you are under anesthesia, the surgeon will mark the areas to be treated based on your desired outcomes. There are different techniques for labiaplasty, including the trim method, wedge method, or a combination of both. The choice of technique will depend on your specific needs and the surgeon's expertise. Incisions. The surgeon will make incisions according to the chosen technique. For the trim method, excess tissue along the edge of the labia is removed, and for the wedge method, a V-shaped wedge of tissue is excised. Reshaping. After making the incisions, the surgeon will reshape the labia to achieve the desired size and shape. The goal is to create a natural and aesthetically pleasing appearance. Closure. The incisions are carefully closed with dissolvable sutures, which typically do not need to be removed. Recovery. After the procedure, you will be taken to a recovery area, where you will be monitored as you wake up from anesthesia. You may experience some discomfort, swelling, and bruising in the days following the surgery. Postoperative care. Your surgeon will provide you with detailed postoperative care instructions, including information about pain management, hygiene, and when you can resume normal activities. Follow-up. It's essential to attend follow-up appointments with your surgeon to monitor your healing progress and address any concerns or questions. Pros of labiaplasty. Improved comfort. Many individuals experience relief from physical discomfort. Enhanced confidence. Improved self-esteem and body image. Customization. The procedure can be tailored to the patient's specific desires. Cons of labiaplasty. Risks and complications. As with any surgical procedure, there are potential risks, including infection, scarring, or changes in sensation. Cost. Labiaplasty can be expensive, and it may not be covered by insurance. Recovery. Recovery can take several weeks, and patients may need to abstain from certain activities during this time. What are the risks and complications of labia surgery? Complications are infrequent, but can include removing too much tissue or not enough tissue, bleeding, bruising, hematoma, infection, wound breakdown, scarring, ongoing pain, pain with sex or loss of sensitivity. Recovery and outlook. Is labiaplasty really painful? You'll have some swelling, discomfort and pain, but it's usually easy to manage with over-the-counter, OTC, medication, like acetaminophen, Tylenol, or with prescription medication for a day or so. If your discomfort isn't well managed with the recommended medications, contact your surgeon. Home remedies, like a cold compress or ice pack, are helpful, too. Apply an ice pack to the operative area, on top of a cloth undergarment, on a 20 minutes on, 20 minutes off schedule to reduce pain and swelling. Most people report only mild pain or tenderness for a few days. Will there be much bleeding? You may have some bleeding for up to a week or so. You can wear a pad to absorb this minor bleeding. When will results be at their very best? The initial swelling, soreness and temporary discoloration decrease over the first couple of weeks after surgery. Most swelling is gone after 6 weeks. But it may take up to 4 to 6 months of healing time for swelling to completely go away before seeing the final results of your labiaplasty. There's usually little to no scarring. How do I wash my labia area after surgery? Use lukewarm water only, no soap, to wash your wound. Gently wipe or dab the area dry after peeing. Don't rub the surgical area. Your surgeon may have you take medication or recommend a diet to prevent constipation so that you don't strain, which could stretch or break your stitches. Follow all your provider's post-op instructions about peeing and pooping. Keeping your surgical area clean and free from bacteria. Allowing the surgical area to heal. When can I return to work, physical activity and sexual activity? You should be able to return to work and other light activities after a few days. But if your job involves physical activity or lifting, you may need to stay home longer. You should avoid the following for 4 to 6 weeks or until cleared by your surgeon. Strenuous exercise. Physical activities like cycling, running and swimming. Sexual intimacy. Returning to these activities too soon can put pressure on the wound, tear stitches and delay healing. Facts about labiaplasty. It is an elective cosmetic procedure, not a medical necessity. Consultation with a board-certified plastic surgeon is crucial to discuss options and expectations. Labiaplasty is not the same as vaginoplasty, which focuses on the vaginal canal's tightening. It's important to have realistic expectations regarding the outcome. In conclusion, labiaplasty is a plastic surgery procedure that is chosen by individuals for various reasons, including physical discomfort and psychological distress. It is a decision that should be made after careful consideration and consultation with a qualified surgeon. Please remember to like, comment, and subscribe to our channel for more informative content. Your feedback and support are greatly appreciated.